thing, just so we can upload this recording for anyone who wasn't able to join us today. And I'm going to share my screen. This is just a copy paste of what Dr. Faddis sent in the group chat um, about like what we are expecting to do for the health fair. And we were thinking about just going through the document together and kind of talking about each point and making sure we're all on the same page. And obviously open to any suggestions if we want to add or remove things. Um, we can totally do that. So, Dr. Faddis, feel free to like interrupt me at any point because I would, if I'm missing anything, let me know. Um, but I guess one thing for sure is that we confirmed to do it on the 24th of Saturday, inshallah, if everyone's free then.
I think, Ayla, we need to get the approval from the EB. We
Okay.
did not get an official approval. I know that Brother Mumtaz is with us on that meeting, but you need to send an email to the EB to get the official approval for that. And hopefully, like, I did not hear from them any rejection for that, but we need to send them an email for that.
Okay. Okay. But we're thinking about the 24th for sure.
Inshallah.
Okay. So, and then for using the new EAC building, is that also what we're planning on doing?
And also, Ayla, is when you send them an email about the approval, then ask them to whether they want us to create the flyer or they will create the flyer for it,
Okay.
because we need to market it.
Got it. Awesome. I'm assuming I can include all this stuff in the meeting, in the email. Cool. And then I can take care of the undergrad and high school volunteer recruitment. I guess this is something that maybe we can touch base on when we like go into the different stations. Maybe we can ask each provider, or the providers who are here, kind of what volunteers they need, and what kind of help they need in those stations. But I can definitely help oversee the undergrad and high school volunteer recruitment. And then Sister Manal is responsible for buying the equipment needed for the events.
Yeah.
Is there any like notes we need to add for this, or are we all, do you roughly know?
So I will add that I will request from Minan to contact all those lectors who are running the sections, and just to get an official approval from them that they are available, because I did not get a lot of response from them. They are in the group, they are some of them in the Zoom meeting, but I suggested some of those sections for them. So we need like to confirm that they are available and then they are okay with those sections.
Okay. You were saying contact like the physicians who are in charge of
Yes,
it?
Yes.
Yeah,
I
Dr.
will contact
Faris.
them.
Yeah, Dr. Faris, is this, I think, should we create maybe a spreadsheet so that and share it so that we have an access, we know who is taking care of what in the spreadsheet, and maybe have it by the okay, this time is going to be these volunteers and all that stuff. Should we create a spreadsheet for it?
So I think what I am planning, and then, probably everyone can correct me, because we have a big building, so it's going to be the whole, and then we have limited time. So all those sections will be available on the same time. It's just like different sections. So whoever coming, if they want like to go to first sections, the second section, we are totally fine with that. It's just I want to confirm that the doctors will be available for all those sections, and then I will take care of contacting them and then see how many volunteers they need and what equipment they will need. And then she might, send you that, and then you can create, probably a sheet or something.
I think that's a very good plan. Then I think my recommendation will be, let's create the spreadsheet where we have, okay, these are the doctors, and then we see, okay, Sister Manal has already is reached out to them, and then if they confirm, then we say, okay, it's confirmed. We know that way. We know all of us are on the same page.
I am totally fine with that.
Okay.
Dr. Faris, one suggestion for the benefit of this meeting, because the group is pretty large, although attendant is, I think, about 20. The group itself is about 150 people. So for the benefit of this meeting, I was just suggesting, why don't you give us the broad outlines, what you want to discuss, and then later on in the subsequent meeting, we can go into details what you're discussing now. At least we know what are the things we are looking at in broad perspective. I know you have sent big mail or text, but it is of the day of what you are going to do. But to able to reach that stage, what we need to do now. So what are the broad areas that we need to focus on?
Yeah, no problem. I can probably say that in less than 5 minutes. So first is we want like the whole day for that event. So it's going to be like two sessions. First is the morning session, which is from 9:30 to 12:30, if everybody agree about that. And that will probably divide it into multiple sections, and including wellness check, for obesity, counseling for hypertension, checking for blood sugar, probably weight, and then a mental health check for somebody who has an anxiety, like how they can deal with that. We're going to have a psychiatrist and we're going to have a psychotherapist joining us with that. And then probably another section will be a physical therapy section for those who have chronic pain. We have a physical therapist and a pain specialist, and then probably Dr. Nadal Makbul, who is a rheumatologist, can joining us with that. And we have also like pediatricians with us. We did that last, health fair. So we can do a physical for school-age children, checking their health and readiness for sports. We can also check their vision and help with that. I think with also having a lactation specialist, and then we have Dr. Aman, who is interested in neonatology. So we can have also a session for lactation vaccination. Also, that's another section running by them. And we have OBGYN who can talk about women health and the stress of pregnancy and delivery. So those multiple sections that we will have. And every section is probably like, I don't know, like we have from 9:30 to 12:30. So it's 2 hours. But as I said, it will be running on the same time. So every few patients probably will allow them, not patients, people will allow them like for a 5-10 minutes talk with the providers, like to get those counseling. That's my proposal. And then the second section, which is in the afternoon after the Dhuhr prayer, will be a lecture for CPR and will be like hands-on education about first aid. And we have ER physician, we have multiple internal medicine physician who can help us with that. And we can buy some equipment to teach them about how to deal with that. I know that I got approached from many of the sisters who run the Sunday school clinic. They don't know like how to deal with kids when they get injured, what to do, where to go. And even our clinic staff, they had that approach, how to deal with minor injuries. So we need to teach them about that.
Would you be interested in like providing certification, or it's just basic knowledge?
I don't think there is like some logistic for that certification. There is an online certification for the CPR, which is
Because I did that for my Girl Scouts. Like we just got somebody, it's a $25 certification for CPR and first aid. But I mean, like if we're just doing it as a general, we don't need to do that.
Yeah, so certification for the CPR, we need to be a trainer. And in order like to be a trainer, I need like to have certain qualification, how often I am doing that CPR. But as I said, there is a national CPR, I think organization or something that will do online exams, and then will give a certification within a few minutes. And it's valid. It's applicable, and then many of our people they got that certification. And I have that in my lecture. I will show them the website, and then they can just do the exam after we do the CPR classes. And it's about like $15 or something, and then they will get the certification. And probably one of my question to Ayla and the group is, do we need to, I usually do a registration fee for the CPR lecture, like $20, and then it help a lot making people responsible for coming whenever they register, instead of make it free so everybody will register and then nobody will show up. So I think I will add a registration fee for the whole event, and let me know if you are okay. All that, money will go to ICBC clinic, definitely. So let me know if you are okay with adding that registration fee.
So are you
Yes.
saying, Dr. Force, are you saying that is having the registration fees for the whole day? Whoever comes in for morning event have the $15, then they can also attend the CPR too. Is that what you're thinking, or just for the afternoon session?
I think I'm planning like to do it for the whole day, so we will make people think that it's it's a responsibility to come whenever they pay money, instead of like just make it free. I don't know, like I am open to all suggestions.
No, I think that's a good suggestion, so that the people take it a little more seriously. And then if we so, but there will be a people, Dr. Forrest, we need to work on one thing is think about. There are people who are not going to say that they cannot even afford $15. So I don't know, that will be the complication, but we need to take it case by case. Or maybe just don't put $15, just put $10 even.
Yeah, whatever amount is, the amount of the money does not mean anything. It's just like whenever they pay, they will be like more, serious, like to come. Yeah, I am
Yes.
totally fine with that. We can discuss that probably in the next meeting, like how much fee we can put.
And it's
Uh,
just to be clear, like we're seeing patients. It's not like, is it like education, seeing patients? Like what exactly am I
so
doing?
it's mainly education. We are seeing 90% healthy people. So you are not seeing patients. You are not seeing like a patient who will come like to get treatment. However, people who have like general health, you will figure that they have joint pain, they have probably some stress, something. So we will refer them to our clinic. And we have all those resources like to refer them, if they need physical therapy or something. So we
But I
did
mean,
that.
my question, because I didn't attend before, so my question is, like, I'll be at my station and people will just be passing by and we'll be talking to them about general concepts. Is that
Yes,
okay?
yes.
So
Yeah.
Faris, this is Dr. Roof. Sorry, I joined late. Do you want me to chime in about the whole sort of
Yes, definitely.
flow of things?
Yeah, because you did that with us like twice. So probably,
Yeah.
yeah. Please go ahead.
So the whole, and to some, this is not news. Those who have done health screenings before and health fairs before, the whole concept of health fair is really screening. And I repeat myself, screening. So typically what happens in the most standard healthcares, you do some biometric screening, such as a group of vital signs, blood pressure, definitely blood pressure. In some screenings, they'll check, things like waist circumference, height and weight, give BMI, then blood pressure, heart rate pulse, and some would some glucose checks. There are companies that can do cholesterol as long as, but by and large, and sometimes you can also make an argument that we're going to do some screening for mental health issues, given that you have the setup and privacy and whatnot. We can do educational awareness for mammograms and colon cancer screening and all these things. If you go out and do screenings, churches would all these things. So that's why, as Dr. Faris mentioned, we're not going to expect sort of more routine patient care visit. We're going to manage chronic conditions. We're going to probably see mostly healthy people. We just need to structure it in a format that all the work that we do stays within our scope and support our specialties that we serve. And, logistically, it's manageable. Again, logistics gonna be an important thing to consider. So far, I think Faris, last health fair that we did at ICBC, we had 20 plus people, if I'm not mistaken, maybe more. We did general checks, blood pressure. We always do blood pressure check, some cholesterol check, and then there was a mental health screening piece. And Faris, you did sports physical, if I'm not mistaken. So these are, some of the things typically that are done in a health fair. We can always modify, again, depending on our needs and capabilities. I think that's in a nutshell what, you typically see, things being done in the health fair.
Yeah, because of that, I was asking Ayla to go over what I sent and all those sections that we have for the stations included in my proposal. So I don't know, Brother Momtaz, did we answer your question in a summary? We took more time.
I do understand what are the plans for that day, but my angle was to be able to organize this event. What are the things that we have to get ready now? For example, getting the doctors, getting the place organized. If there are any refreshments to be made available, so different things, and equipments to be procured, maybe reagents for testing. So the various components that will make the fair successful. And on the fees, I would suggest we keep it to 10, because since it is just a screening, unless people are very serious that they have to come and see the doctor, may not like to spend a large amount. If they are members in the family, there are 3 or 4 people. So keeping it to, I think 10 would be reasonable, not free, but 10. That's my suggestion.
You're talking about the ER's sort of certificate program, fee for the certificate program?
No.
It's not a certificate program.
Just join. Yeah, coming to the fair for screening, so that people, they take it serious. It's not free.
Yeah, so it's a trade-off, Brother Momtaz. It's a trade-off. If you look at other models, again, let me just explain. So there are vendors that do these screenings, and they make money from the testing. So if you do coronary artery calcium scores, if they say, well, if this is abnormal, you go to talk to your doctor, and you follow up with them. But sometimes they charge a one-time flat fee, and let's say $70 for coronary artery calcium score.
Right.
Other places, these screenings are often free or free-ish. You can charge a nominal fee, maybe $5, $10. But if I think I was seeing the list, the agenda, Faris, if you're talking about CPR and certificate program and all these things, I think that's a very different ballgame, as opposed to just a general entrance fee for biometric checks and some diagnostic glucose, cholesterol, and all those things.
So in summary,
I think that's what Dr. Forrest was saying is in general, whether you come for the screening or the evening, afternoon, it just have the entry fee of $10, and they can come evening, they can morning and the afternoon.
Yeah,
I think that's how.
Yeah, and I did that with the previous CPR classes, and it was very successful.
There you go.
People were very serious, and then all of the registered people, they came.
So are you suggesting, Faris, then there's a general entrance for, $10 for general entrance, and then what if people sign up for CPR? That should cover CPR too?
Yeah, probably I was thinking about combining them with the $20, but we can do like $10 for the first session, and then sorry, I got a call. Am I okay? Am I back? Somebody called me. Okay, so and then I can probably like do another 10 for the entrance, or we can just do it like $10 like for both of them, if you are okay with that.
But Dr. Forrest, what is going to logistically is going to create it's going to create a not an issue, but it will be then we have to create a different registration forms and all that
Okay,
stuff.
yeah, no
So
problem. Yeah.
Faris, what you can do, have people sign up for, some people may sign up for CPR, and then once they sign up, ask a fraction of them, like, if they need a certificate program for job or whatever for their record, they need to give additional $5 for certification, something like that. In that way, whoever wants to participate will participate, but whoever wants the certificate will have to shell out more money.
Yeah, that's fair. That's fair.
Okay, no problem. We'll do that. I think we can go back to Ayla and then let her lead that so we will not run off the time.
Okay, awesome. Cool. So I guess we can go to talking about, wait, sorry, ICBC volunteers responsible for preparing the EAC building. Sorry, I'm not really sure if there's.
Okay, no problem. So Ayla, for the EAC building, we can talk also like to the EB and then ICBC team regarding what equipment we need to have. And then probably Manal will help you like to buy those equipment from, I don't know now, from our donation. We have some donation like for the ICBC that we have money for that, or we can get some organization to sponsor like that equipment. I know that for the CPR and the first aid, I will need a lot of preparation for that, and then I will take care of that.
Okay, sounds good. Cool.
This is Ramona. I have a quick question about that. Would we make like a sign-up sheet that way, like the day before, people know, when we're coming in to set things up? If not, I feel like it'd be difficult the day of, or what did you have in mind?
I think our last time we did the sign-up sheet like on the same day, like when they come, they will sign and then they will probably last. And then we know that for those people who paid the registration payment will be like early. And I need somebody like somebody will put in the flyer like an email for somebody who will take care of, contact if there is any question or something. For the CPR, I put my email. I think for this big event, I need like the volunteers to take care of that.
Okay.
Ayla, before you reach to the session, I have a question for you and for the whole people. Are we okay to get some people to take pictures and record some of that for the future, advertisement about our work and our clinic? We can get the people like to sign that they will get, to be photographed, and then probably we can ask them like to talk about the events in the middle of the event.
So that's a great point. What you can do is create a disclaimer and general sign off that there will be, there will be some photographs taken to capture this event, and how the photographs will be used is going to be used within the either EIXSYS clinic or ICBC mosque social media sites, as opposed to TikTok or Facebook. So it has to be very explicit if you want to photograph people, events. Video is a different ballgame, Faris, because if you want to video, then people, sometimes maybe a little bit more sensitive, because you can get, speech and much more facial recognition and whatnot, I think. And then, I think people in general are a bit more sensitive to videos than they are to photos. But as long as you have a general waiver or, sort of a sign-off sheet that, hey, as part of the registration that do you sort of agree to being photographed as part of a, for our, internal advertising and for, future events. I think people would really then sign off. Unless someone say, well, I don't, I can register, but I don't want to be pictured, then I think we should respect that. Then becomes like, you try to track them and make sure that people that, hey, if you do not consent to be photographed, then just let us know, and then we'll make sure that we don't take pictures when our photographers are here. As long as you make a general statement, I think that'll be fair, most fair.
Totally fine.
Sure.
And then
Like
when I said,
Dr. Forrest,
yeah,
sorry. Okay,
okay,
it's going to be pretty easy. So once we have the registration, probably a ticket tailor, if we are putting the price on it, we're going to create a ticket tailor. We can put the waiver form in there, and without them signing the waiver form, they won't move forward. But that's a good question, though, good point you brought. I was actually is going to talk to the cameraman too, who can take a professional video like we did in the award gala. If we are doing it a whole day, I think this is worth capturing it, and then
I agree.
and
Yeah,
capturing it, and also even putting some reels and stuff like that on our social media.
okay. And then
We
definitely, so for the video, probably I will ask only volunteer to talk, or like the doctors, not like the actual people. Actual
No,
people we
we're
can.
not. We're going
Oh,
to be. Yes, you're right. So we probably
okay.
have to have for the logistics. I think we need to have a separate meeting for that. So let's
we
go
did
with
it
that.
yeah,
we did it for our events before where we would just have a band for people who said no, and the photographer would know this is like a band. I mean, they're like these little
Oh, great.
paper bands, and the
Mm,
photographer knew that these people didn't want to be photographed.
great. That's a great idea. Thank you. Mm. My other question regarding probably that's to Ijaz and Brother Mumtaz. Are we inviting any city officials to that event?
I was going to ask Mir to come for sure, and I will also going to ask this was my thought, is for both fire and the police to see if they can come and see if there is any city officials of Cedar Park available. But I don't know whether you guys met, there was a William, that veteran guy, he was from Fort Worth. He was an ex-military guy. I was going to ask him, he has a lot of influence into the cities. I was going to ask him to join us.
And Brother Mumtaz, do we need to get the
to try to.
EB approval for that invitation of the city official? I don't know, Brother Mumtaz. Probably Ayla, like you can add that, like also in the email that you will send.
Dr. Farid,
So
to answer
yes,
your question, I don't think the whole matter has been brought to the EB to a serious level yet. I haven't heard any discussion yet, so I think you should quickly get in touch with the EB on a personal level and see
okay.
if they can deliberate, and because they are not in the full radar yet. I just took my personal initiative to join this.
Yeah, definitely, no problem. I was, planning to talk to them after this meeting, inshallah. Okay.
Yeah, so from there you
Okay.
clear whether the city officials can be included and how and who.
Okay.
And I'm not sure if you guys are aware, there is an initiative that is going on in Austin, not Cedar Park, January being Muslim Heritage Month. And we're doing several activities throughout the city. City officials are coming. But I don't know if you want to like advertise it as such. Maybe I know the organizer. I can talk to them if you're interested.
Yeah,
But see
probably.
that is just a Muslim awareness but I don't think we should personally tag it, because this clinic we serve anybody and everybody in there. I don't
Yeah.
think on this wellness day we have, because we're not tagging it as a Muslim day. We're tagging it as a wellness day.
Yeah, it's basically just the Muslim Heritage Month is mostly highlighting what Muslims offer in the city. But I mean, it's not necessary, but I'm just saying that they're doing several events throughout Austin all throughout January.
Which, I'm sorry, I missed that. Is there a particular organization sort of doing coordinated events?
There are a couple of individuals that are coordinating. They're doing an art gallery, entrepreneurship. There's a library event, and another I can't remember, but and and a service event, like Meals on Wheels or something. But it's not Cedar Park; it's Austin.
Yeah,
I know what I think what you're talking about. We had that event today, but that's more like on the individual
Yeah,
level. I don't see the organization level. I think is my suggestion is knowing what you're talking about now is we should leave it as it is. To me, I don't think we should get affiliated at this point because if it was some big organization like a CARE or ICNA or something like some of those, then there's definitely makes sense. But
care
it
is
is a
involved. Care is involved. But again, it's Austin, not Cedar Park. But the idea is nice that inviting a city official.
so we'll
yeah, I
definitely
think
Because they
once
are
it,
being invited. The Austin city officials are being invited to the events in January.
I think I
okay.
think I think I agree with I think others who chimed in about the sort of the underlying organizational structure. I mean, to me at least, this is something that serves Muslims, non-Muslims, atheists, right? I
Yeah,
mean, we're talking about
Yes.
physicians. I mean, at your clinic, you have no control over who you see, right? I mean,
Yeah.
for sure.
our intention is to serve everybody. Whoever
Yeah,
can make it to
Exactly.
a door, that's
yeah.
how we should keep it. And
Yeah, yeah.
I think maybe in future we
Let-
can align with others who are doing similar things. But for now, let's keep it the way it is.
Okay.
well, inshallah, I think we should approach it differently. We will get, inshallah, some sponsors for the event so that we cover some of the costs, but that will
That's
be only totally different thing.
yes, exactly. I think sponsorship helps. I think some publicity helps
Yes.
in terms of sort of capturing what we do. And I know in October 2026, when we'll have our gala event, this could be highlighted,
Yeah, of
right?
course. Yeah, and by the way, it's not off the topic, but there is also another event we are doing in collaboration with another organization that's a healthcare organization too at NAMCC too. But that's not on this bigger level. That's only 3 to 4 hours. But access will be involved in there too.
Okay. Okay. So I want to go with the Ayla probably, and then go over the flow of the first half of that event. So we are doing vital sign station. Is this like will be like for everybody? Because we might not have time like to do for everybody if they won't just probably go to a mental health, or probably I am thinking about adding also a joint and pain or something. But last time we did vital signs for everybody. What do you think? Like, should we do it for everybody? Whenever they come, they will get blood pressure, heart rate, oxygen, weight, and
No,
probably
probably not
height.
everyone. Far it's not probably not for everyone. So if there are people that are just coming for, you know, mental health issues or, some dedicated, therapy sessions, joint activities, nobody's going to look at the data and act on it. So whoever is not going to look at the data and act on it, then there's no point collecting the data, right? Very
Okay.
Yes, true.
fundamental medical school stuff. Don't
Okay.
order anything that you're not going to follow up on.
Okay, yeah, no problem. So that was also like my suggestion. So how we can guide them whenever they come, we will tell them like which
We'll be triaging, Faris.
sections.
Yes, Manal can. I mean, it'll be simple triaging. You know,
Okay.
1, 2, 3. Are you coming here for one of these things? If general health screening, pressure check session activity. If they're coming for joint activities and have mental health issues, then no vital signs, they get a quick triage.
Okay, yeah, that will be fine. And then probably those who want also the advice for vaccination, lactation, immunization,
Yep.
or women health, probably we can also ask them about that. Okay, yeah, that's
Yeah.
fine. So we
Yeah,
can
and that,
triage them.
yeah, I think that begs a good question about sort of, I think, at least in one of the sessions, Crystal was involved in some counseling. So wellness and health is all about prevention, including prevention of common cancers. So something to think about.
So what I will do, I will ask Ayla and Manal to reach to each of our providers and see their interest regarding which section they will run. And then probably we'll have another meeting specifically for those sections.
Yeah, and Faris, that's such a great call out, because I think maybe reach out to Crystal and maybe whoever else is interested in talk about women's health, focus, like let's say breast cancer screening, talk about mammogram, cervical cancer screening,
yeah,
because I can tell you data that in South Asian community and probably in Muslim community, these breast cancer screening, cervical cancer screening is actually lower than white populations.
yes, definitely we'll do that. And then we have Dr. Linda, who is OBGYN, and
There you
she
go.
actually she had a lecture recently in ICBC, and Ayla was with that, and probably she can help with that screening and then awareness and counseling. Okay, yeah, that will. Anything else, Ayla?
I was thinking for the doctors, the physicians who are here, maybe we can just like quickly run over the stations that they're assigned to and just get them to see if they're comfortable doing that one, since there
Okay,
are some physicians here.
yeah,
Yes, that will be easy.
Yeah.
okay.
I believe Dr. Asma.
We have Dr. Masoud, Dr. Raouf, Dr. Abdul
Abdul Aziz, Abdul Hamid, Dr.
Hamid with
Abdul.
us. Yeah.
So Ayla, what questions do you have for the doctors?
I was just making sure that the stations that they're assigned to, I think Dr. Faddis was saying that we had to reach out to the physicians and see if they're comfortable running the stations they're assigned to. But because some of them are already here.
Yeah, the last, just try to model the last time we did it. I think there are like 2 or 3 physicians basically looked at blood pressure and general labs, right, Manal? Like cholesterol, blood glucose, and blood pressure.
We're
In
gonna
those,
do the cholesterol?
I'm just asking. I don't know.
I don't
Faris can
think
tell.
so. We'll do
Yeah,
that.
Okay.
yeah, we'll work on that later. So
Okay.
I have internal medicine doctors like who are with us, probably 3: Dr. Masoud, Dr. Raouf, and Dr. Abdul Hamid. Are you okay to run that probably obesity, high blood pressure counseling? I don't know, like what you're gonna call it. Mm, yeah,
I
probably
think
obesity, nutrition, exercise station or something.
yeah. So if you collect BMI, so really all the internal medicine people will be looking at 3 data points, right? One is
Okay.
blood pressure, one is BMI, if you collect the BMI, and the third point would be fasting glucose. Or glucose, I don't know if we can
Yes.
capture that.
Okay.
Or random glucose. I don't know if people
Yeah.
are going to be fasting, depending on what you do, when you do it. But
And I
those
think
3 days,
I put that
yeah.
in number 4 of my proposal. So I said like obesity, nutrition, exercise station, which will be BMI, I wonder if you like the waste conference, which is the new way of calculating the risk for obesity. You know that better than me. And I put you, Dr. Mujahid Masood, and Dr. Abdul Hamid. Are you okay? All of you like to run that station, so we will just depend on you, like to take care of it, and then just give us what you want.
Are you asking me or the group?
Well, I'm asking you, like, if I get your approval, I will probably get that to the other.
Yeah. I mean, yeah, that's fine.
Okay.
I can handle these
Okay.
data points.
We
Dr.
are
Masood?
okay with that. Yeah.
Okay. Dr. Abdul Hamid?
Sorry, I responded in the chat, but yes, inshallah.
Yeah, he said
Okay,
yes.
inshallah. So that's great. I think Ayla, Dr. Aman with us also. Dr. Aman, are you
Yes.
okay with that lactation section?
Yeah. So basically, I also wanted to ask, like, for instance, if like I have Nuha with me and maybe Sarah can join us, but then, for instance, if families, like if a mom needs help with breastfeeding or whatnot, can we have like a private space for that?
Yes, that's the beauty of our new building. We have multiple rooms, and we can have one room for you. So it's going to be totally private. They will come. Room is like already isolated, and then you can talk to them, and then probably one by one.
And then are we gonna, for instance, be able to provide some like breastfeeding equipment, like a pump or whatnot, or is it just like refer them to WIC or give them resources? But
I think give them resources. If we have, I don't know like how much are those equipment, and probably we can buy some of them. I probably like will with that. We have some funding even from the clinic.
I can like give you a few things that might be helpful. Maybe like vitamin D supplements, because a lot of people don't use those. Some pharmacies might be able to give us some samples. I don't know, like stuff that is for newborn care.
Yes, definitely. We have a pharmacist with us who gave us like some samples. We have the samples, and then we can go and get more samples from him. Actually, he's planning to attend the events.
So far, speaking of the pharmacists that we have, this might be a good opportunity to showcase his relationship with us and his involvement and contribution. Can we ask him to donate maybe 5 blood pressure monitors for people that may need them? And we can put some criteria about eligibility for a blood pressure monitor, because he may have access to some blood pressure monitors.
I think I will talk to him, no problem.
Okay,
we can talk to him. He's already like helping us a lot with providing us a lot of
haven't talked to me because I know which blood pressure monitors are good ones.
Okay.
Okay.
I know that. I can deal with the blood pressure because this is my specialty.
Okay. And then my guess is that there is an infant scale at the clinic. Do you know? We do have one.
Have.
Okay.
We have. Yeah, we do have one. Yeah, we can.
Perfect.
We can provide you with that. No problem.
Wonderful.
Anything else, Dr. Aman?
No, I mean, I might have like a little poster, some resources.
That'd be good.
Just like a general concepts, I guess, and then things in different languages as well.
Okay, no problem. Probably our volunteers will help you with that, and then Ayla can assign some volunteers to help you with that.
Yeah,
Ayla,
I think that's a great call out for us. I think in future, and we may not have time. I'm making this up. 30% of our patients might be Arabic speaking, right? Which isn't a good number. So can we build some, leaflets in Arabic? Our population, I don't think anybody is Spanish speaking primarily. So considering in future, educational materials in proper, the language like Arabic would serve our patients the most, because English, literature, pamphlets may not be as serving as Arabic ones to people.
I know that,
That's
I
the
know,
primary.
yeah, I
Yeah.
know that the WHO has a lot of languages. I mean, we can also use some of that.
We can, yes, that's a great call out too. I mean, I don't thank you for that because I, I know of only Spanish and English resources for educational stuff. But yeah, if anybody has access to like Arabic resources, help education resources, that'd be wonderful because we should really put these things in languages that are represented in the population that we serve.
Great fun.
I would like to
Ayla,
suggest to where even if a patient like can speak English, just to ask them if they prefer something different language, because even if they can get by with English, um, they still might understand the pamphlet in their native language much better for the sake of like understanding
Yeah,
the information.
yeah.
And
Yeah.
then will we have, for instance, like I speak Arabic, but a lot of our patients speak either Urdu or Pashto or whatnot. I mean, will we have access to native speakers? No.
Yeah, we may. I mean, if you're talking about, interpreters, that's a whole different ballgame and logistics, and could be a nightmare to coordinate care with a untrained interpreter because these people would not be trained. So there's some little bit of risk because, as you all know, there's a huge difference in using a trained interpreter versus a non-trained interpreter in medical setting. So my personal recommendation would be to stay away from untrained interpreters. Sometimes you have no option but to use a family member, right?
Yeah,
But
I mean, I don't mind using a family member for now, if that's what
exactly,
you guys are
exactly.
doing.
So yeah, exactly. But then if you ask for other, like, I know there are a lot of people who speak Urdu, then having them in the clinic, in that space, it just logistics, at least to me,
so
and then
probably
privacy issues too.
what we can do, we can ask our providers or our
Yeah,
I don't know, like
yeah, yeah. So I mean, I speak
if they speak.
Bangla. I speak Bangla.
Good.
So when I have a Bangla speaking,
So
patient,
you
I
will take
speak.
care of that.
Yeah,
Okay.
yeah.
No problem. Yeah, go ahead.
When our patients are signing up, like for instance, when you're doing the $10 fee, things like that, can we ask for their ethnicity or just to get an idea of we might have 10 Bangladeshi patients, we might have
You,
20 Arabic
you may
speaking
ask
patients. That
for,
way we can
yeah,
coordinate.
you may ask for language preference, but I would not ask for ethnicity because it's sensitive. I mean,
Okay.
it's sensitive
Okay.
because some people may.
I think we need to keep it simple this time because we're talking
Exactly.
about just a wellness day, and then if we start asking for the language preference, then they will say, and then they will assume that we're providing them the
That's true.
interpreter.
Yeah,
So
that's true.
actually, what's going to happen is with our community, so many languages out there. There's always going to be somebody who can interpret for us if needed.
Yeah,
Also, how are we going to avoid any HIPAA violation during this fair?
Yeah, that's a great question. Faris, let me answer that because, in the past, what we have done for behavioral health, we had a very dedicated space, for maternity or any lactation or any women's issue. We have a separate room, so we could arrange separate room, one-to-one interaction for if we have a table with two doctors sitting 4 feet apart and having two patients at the same time, there is a risk that some people may overhear and other things. In the past, I think we I don't know, Faris, correct me if I'm mistaken, we only had two patients sitting at the same time. Maybe there is a bit of a flow. We can but that's a great call out. I mean, if patients may sign off by saying that, well, they are comfortable sharing their high blood pressure in an open space. I think other health fairs that I've seen and been to, they know that, they get a paper and some people write something and then they talk to a doctor. But I agree. I mean, Faris, do you have any thoughts about how to make it
yes,
much more HIPAA
actually,
compliant?
Actually, with the new building and with our clinic, we have multiple separated room, and then each
there you go.
section will be like away from even not few feet. It's just like it's totally separated room. Like in our clinic, we have a 3 patient room, we have the doctor office, we have the procedure room, and in the EAC building, we have probably like multiple classrooms that
So
we
we
can.
can have, as long as we have a one dedicated private room environment, then it would be good, right? Dr.
Yes,
Faris, is that what you're saying? Okay.
yes,
Hope
totally.
that answers your question. Yeah.
I had a question about the language barrier issues. Is it possible for us to find a like live technology and the patient is belief?
So that's what we translate. What we are, people will get from that. Usually, like for the medical translator, and people will go like to get a certificate for that. So I don't know like how viable is that, and then if that's like appropriate. As Dr. Raouf said, probably most of those patients when they come, they will have their family member with them who will translate to them, especially older people who are visiting or something. And they trust even in my clinic, whenever they come, and then I will ask them, do you want translator? They will say, no, we want like my son like to translate to me or something. So I think we are fine with that, unless I know a couple or 3 patients that they don't know any any way like they speak French actually, so they call their friend and then he will translate. I think that's probably will be an exceptional. I don't know like how to use that.
Okay. Like and in the case like because of HIPAA, is it all right just in the as a hypothetical to use like a live translator with patients?
Dr. Raouf, what do you think about that?
Well, what's the question again? Sorry.
I mean, just if we're thinking, I'm not like educated about HIPAA violations, but is it allowed or like is it okay to just use any translate like Google Translate to translate between patients? Or would you find something like free that we use in the clinic?
I mean, HIPAA only applies to the communication between a provider and the patient. It doesn't matter how you communicate. If you're using a technology-based translation like Google or a human translation interpreter, I think, I'm not sure HIPAA applies. If you are not sharing information in an open space, I think HIPAA comes into place, as earlier stated. If we're having one-on-one individualized doctor-patient interaction, which is what we had talked about, then it's at the discretion of the doctor, right? The doctor may decide, well, the patient only speaks Turkish. I'm going to ask family member to join because I'm going to do some counseling on the blood pressure or other things, right? Then it'll be at the discretion of the physician to use. While the family member is not any good, I'm going to use Google Translator and I'm going to use go that road.
Okay, thank you.
Ayla, anything else?
I guess last thing is I just wanted to touch on for action items so we can like leave this meeting with like tangible goals. For one, definitely sending out the email to the EB. I can try to draft up a draft and get it approved by the Dr. Faddis before I email them, or if anyone else wants to email them. I think would you like me to email the ICBC board?
Yes, yeah, I
Okay.
want you to email, and then probably we can go over that email and then get the
Okay.
approval.
Perfect.
And
And then
Ayla, who's going to be the doing the marketing? Like, is it going to be through the ICBC internal communication channels?
I think we need to target it both ways. Dr. Imran is we need to use the ICBC channel, and we need to use the Austin wide, all the massages and other channels to market it.
Yeah, as long as
So
ICBC is okay with that.
yeah, I don't think this, because it's an open event. It's not like just a ICBC only event. So we need to market it so that more people from around Round
Yeah,
Rock or whatever
which
area.
yeah, and assuming that we need to create a flyer of sort, and then have
We
a talking points.
definitely need to create a flyer. Without that, we
Yeah,
can't
so
market
that's why
it.
I'm
So
bringing the issue, because that will be an action item, Ayla.
Yes.
Social media campaign.
Yeah. I believe Brother Jazz was asking me to ask ICBC if
Can,
they
can,
want to create
so
the flyer or if we should.
somebody on that, like we need to mute.
Someone needs to mute their phone. Thank you. Sorry, go ahead, Ayla.
No, I think Brother Ijaz was saying that in the email that we sent to ask if ICBC wants to create the flyer or if EIXSYS can. If it is EIXSYS, I'm sure even some of like our volunteers who are like the students, the undergrads, maybe I can reach out to some of them and see if they want to create a flyer for it.
no, if they want us, I have actually the flyer guy, professional guy who can do it for us.
Okay, perfect.
Okay.
Still, Brother Ijaz, we need to give the approval for that flyer from ICBC, and we need their name like to be big in that, because
Yes,
we are using
for sure.
their building and we are using their clinic.
Brother Faris, let me suggest on this one. Once we have the first meeting with EB on this program and everything is sorted out, the rest of the things will fall in pieces very easily. Like we have a person who does flyers for all our activities, and they should sing. They should look like an ICBC come EIXSYS activity, so not something different. So we can do that. We can do that, and also you will need other help. Like on that day, you need somebody to come and help you with setting up the tables, chairs, cleaning up, and so on and so forth. You might think of that.
So, Brother
Definitely.
Momtaz, my only ask is that whoever makes the flyer, from ICBC, there is a bit of an urgency to it, because I'm pretty sure Brother Isaac would like to have the flyer ready yesterday. Because I think these things are time sensitive.
Don't worry about that. We know about the urgency.
Okay, good.
Also, with almost urgency, so it will be better if you run it through our EB. All you need is the material. Suggestion. We'll share the draft with you, and then you can suggest any modifications before it's finalized. That's not a problem.
Well,
Ayla, what else?
I have a question.
Go ahead.
So I know our event will be in the new building, and usually we do the CPR on the floor. The new building, they don't have carpet or anything. How are we gonna do that?
Yeah, we can. We have got roll carpet. We can use it.
Okay. Yeah.
That's why we need to look at the whole logistics. How many rooms? Where exactly? How you fit? How many vendors? We have to go over the whole blueprint.
Yeah, no problem. Like we have many rooms, and then we can use the carpets for that. Even we can use the I don't know, like depending on how many people will attend the second session, so we can arrange for that. So definitely there is no problem with that.
Yeah, no problem. We'll do that. We'll be able to arrange that.
Okay.
One thing I was thinking, maybe we should set a deadline as to when we're reaching out to each of these physicians and seeing like if they're comfortable with what they're assigned to, and also like what equipment they need. Like I know for lactation we talked about this stuff, but maybe we can get like a running list of everything needed by next week. I don't know, is that realistic? I think Sister Manal, you were saying that you were interested in. Okay, perfect.
Also, I don't know if this is on there already, but besides like station specific equipment, just general like cleaning, disinfecting, masks, whatever we may need.
Yeah.
Would be a good idea to put on there.
Yeah, like for the inventory. One thing that I was thinking was maybe we could ask each of the stations how many volunteers they would need. Like, besides the physicians who are in charge of the stations, so that we could see if we have undergrad students or high school students interested in volunteering, like more specifically knowing how many each station needs and like what roles they would want them to fulfill, if any at all. Because each station might have a different need. So that's another thing I was thinking we could ask the physicians themselves.
Definitely. And Ayla, you need to reach to your volunteers, make sure that they are available. So whenever you assign somebody,
Yeah.
and then probably you have like a little bit, just in case, a backup for somebody who will be sick on that day or something. So we will not get behind.
And I think the one more thing when it comes to logistics, and given that we'll be doing the event in the new clinic space, depending on the time, we need to monitor the traffic and the flow of people from one place to another because we don't want very crowded front side. Just think about constraints, right? This is a good exercise where you use your lean principles. So we may need to think about, maybe like, how many to register at once? Do we need to this is where the volunteers will be helpful. Do you need to have a pause time? Like, okay, we can only take one more person because we're at a maximum when it comes to flow in between places. Just something to think about because the clinic space is dedicated, it's nice, it's structured, but it can be crowded. So imagine that you're registering 5 people at one point, and people are going from different places. Something to think about.
And probably, Dr. Raouf, we need to watch that we will not spend a lot of time with one person. So probably one of our volunteers, they can probably remind us, like, you have many people waiting for you. So probably like just move and then
There you go.
move
That's
on.
exactly what I'm talking about. So this is setting
Yes.
the expectations that each station will likely be no more than 15 minutes. I'm making this up, or 10 minutes,
Yeah.
possibly, could be short and sweet, but that flow is going to be super important because you want people to have a very good experience as they go through, from vitals to the next station and then out, right? So something to think about.
So probably one of the things, do you want us like to start early? I put 9:30 to 12:30. That's only, I don't know, like 3 hours. So do you want us like to start at probably 8:30? So we'll have more
I would
time.
say my personal preference would be just start early because if you there is usually a bit of an early rush. Some people may show up early and then it slows down a little bit. Maybe build a gap between, like, if you're doing a second session or CPR, but start maybe early, 8:30. Whoever comes will come. It doesn't matter if it's 8:30 or 9:30, right? So plan early, think about the flow, put enough volunteers and supplies and things like that.
But see, the thing is, Dr. Roop, is if we start that early, that means we have to be, as a volunteers, be there at least hour before that when the program starts. Keep
Which
that in the consideration too.
we are ready for that, Brother Ijaz.
No,
Yeah, brother, it does. Yeah.
Even
No,
early morning.
I don't have a problem with that at all. I want to make sure that everybody.
Yes, no, I agree. That's a good call out. Usually volunteers are usually, hopefully they will be kind enough to show up early. I mean, think about the timing. Fariz, when are you planning this? Next month?
So we are planning next
January
month on the
23rd.
24th.
24th of December?
Of January.
January, sorry.
December, we are not doing
No.
anything.
Okay. So 24th of January, 24th of January is still, I think, I'm making this up. Sunrise would be probably close to 7. So, the volunteers may need to show up, I think, maybe 7:30, 7:45 for an 8:30 start, right, Faris? It's not going to be
Yes.
super early. We're not asking them to come at 6 a.m.
And we don't need all of them. So probably
Right.
few volunteers can help like to do that. And then when they will come like Definitely for me, I can come at any time, like even early in the morning. So we have a lot of people volunteer. They are very dedicated. Whenever you ask them like to come, they will come.
Well, it may be a good idea to at least get a list of names of the volunteer who have confirmed, that they are going to help out.
Okay. Yeah, Ayla will take care of that, definitely.
Yeah.
I have a question for Ayla about like volunteers. Um, for many of our patients, if they see like, for instance, like a male patient, if they see a table with like all female providers, they might not feel comfortable. So is it possible to have both at least like one male and one female at each station, as besides like the women specific stations? Is that possible? Do we have like enough male and female volunteers for that? So like if the doctor is male, you can have a female volunteer and vice versa.
Yeah, that's a really good idea. I can reach out to some people who like thumbed up my message about being interested in helping and volunteering, and we can definitely like stagger it, and be more strategic about like the gender of each volunteer and that stuff. But I think majority of the people who like my message were women. Like we have more female volunteers than male volunteers, but I can definitely keep that in mind. Like that's a really good idea.
And if like that is something that we end up doing, maybe it would be a good idea to market that to get more people to show up.
Yeah. Yeah. Thank you.
But
That's a good
Ayla,
idea.
probably also like having a name tag for all of us, like other
Mhm.
Yeah.
volunteers. So our name and then probably like just, I don't know, like just simple name tag. We don't need like a fancy name tag.
Yeah.
Okay.
And we
I
need
love.
all our volunteering wearing EIXSYS t-shirts.
Yes, no, that's what I was going to do is I think that will be good. So we have those white t-shirts. It will be good to have all the volunteers, everybody wear that shirt.
Yes.
Yeah.
Ayla, we are coming close to the Isha prayer. If we can wrap up.
Yeah. That's basically everything I wanted to say. If anyone wants to add anything else.
Can you arrange for another meeting, Ayla, like when we
Yeah.
should do it so we can have like more
Detail.
updated information, more details about that? What do
Yeah,
you
sure.
think?
Definitely. I think for sure if we before the second meeting we should get the EB approval and then also know specifics of what equipment is needed for each station. And then we can go from there. But I can hopefully in like the next week send out another poll. And I'm open to any suggestions. Like this is more of y'all's event than it is.
I think let's target the next meeting for Thursday evening if everybody is available or whoever is, so that at least we know what our target is, so that we get the ball moving fast on this one.
Yes.
Because we literally are only 4 weeks away by the time we get the approval and everything.
Okay.
So when you say
Give me.
Thursday, we have QCIC. So I think probably I don't know, like weekend will work better for all people, and then Ayla can also post the time that will work for the people, and then we'll do it. But during the working day, I don't think we have time for that.
Yes.
Definitely. I can give people more of a heads up too this time.
Okay.
And if the
Awesome.
following meetings can be recorded, unfortunately, I work on the weekend, so I'd love to be able to listen in, if the meetings happen to be on the weekends.
Yeah, of course. This one's recorded
Thank
and
you.
I'll figure out a way to
Okay.
post it. And then I can also share this notes in the meeting as well.
Okay,
But yeah,
perfect.
awesome.
Thank you a lot, Ayla.
Thank you,
doing a great
everyone.
job.
Assalamu alaikum. Thank you guys.
Assalamu alaikum,
Thank
guys.
you.
Thank
Thank you.
you.
Assalamu alaikum.